let's start with double XL. So the trick is to put the two fingers under the gonion. You see where is the projection of the angle, and 1 centimeter from this gonion you go down to the bone, and here we are. You see I'm on the bone, and you start to inject. It's an anterior grade injection, right? Ça va, Myriam?
It's okay.
Okay, perfect. So we go slow as you go, or as less painful is the injection. Okay. So I try to create this bolus, but it's more than a bolus, it's a pyramid. Right now I am moving upward to create the upper part of the vertical branch of the mandible, and I start to create the horizontal branch of the mandible right here, and I try to create a pyramid shape here, right? And I finish again down to the bone and a little bit more superficial to create the last projection under the skin. And this is safe because parotid gland is higher, facial artery is here in front of the masseter, 4 centimeter or 5 centimeter from where we are. Well, so there is not a lot of dangers here. It's safe if you stay on the bone or subdermal, subcutaneously. So you see on the front view, we see obviously the shadow and the projection, and that's just with 1 ml and the pyramid, the bolus injection. We see the projection laterally, and we lower the mandible. Now I'm going to use a cannula to project that part. So before we use the cannula, I like to put a sterile gauze with antiseptic to avoid to touch the skin and the hair, because then it's not sterile. You put your cannula under the skin, and that's the length of the cannula, so it's long enough to go from here to here. I don't want to inject here because there is a preaxial sulcus and the mandible is well defined. So my goal is to inject a triangle, a long triangle from the gonion to the preaxial sulcus. With the 23 gauge needle, we use the same entry point, and it's a subdermal injection. So I use all the lengths of the needle. Just control it's not bleeding that much. And then with the 25 gauge cannula, and then we go under the skin softly, and anterior grade injection. So I see what I'm doing. Some people use the retrograde. I prefer the anterior grade because it's really creating the volume and creating the shape. When you do the retrograde, you put your cannula on needle and then you inject retrograde. So you don't see exactly what you do. So I can go a little bit lower than the mandible to lengthen her lateral part of the mandible, like this. Right? Okay. And this is 0.5 ml of double XL. So this is with 1 ml and a half or of double XL. Voilà. So we have a good shape. We can start like that, do the other side, and then double check if we need a little bit more.